Hello everyone, this is Jessica Shields and this is discussion board 5, talking about the importance of antibiotic stewardship and how important that is with Ebola and management of the new drugs. So I wanted to start by saying that antibiotics are the most important tool we have to combat life-threatening bacterial diseases. And overuse of antibiotics increases the development of drug-resistant germs, which then leads to a huge problem causing many deaths because of the resistance and the patients not being able to fight the bacteria anymore because the antibiotics that are used mostly to fight that specific disease no longer works in that patient. So the antibiotic stewardship is a framework to decrease inappropriate antibiotic utilization in hospitals. It helps ensure that the patients are getting the right antibiotic for the right disease, and they're taking it for the right time frame and the right duration, and they're getting the right dose. The stewardship programs have many studies that show that it saves patients' lives because it decreases the resistance that are built up. It saves the patient money as well as the hospitals. And it also helps to improve patient care by decreasing their hospitalization stay. It also, by giving the patients only the right antibiotic for the right duration, it decreases their resistance, and it also decreases C. diff infections, because C. diff comes from a resistance built up, so it decreases those infections. So some of the ways that they are doing it, they make sure that they start the antibiotic therapy promptly, and by using the national and hospital guidelines, they can specify the expected duration of the therapy from evidence-based practices to ensure that they are providing it for the right duration. So it involves the entire healthcare team working together, such as the doctors working with the pharmacists and the lab, as well as the nurses, and the whole interdisciplinary team working together and discussing the patient's current status as opposed to their past status and how they're reacting to the antibiotics. So it is definitely a great project that they are working on, and hopefully it will become more in more hospitals. It'll become more worldwide, is what I was trying to say. So our role as healthcare providers is we get together and get together with the other interdisciplinary team, such as the doctors and the pharmacists and everybody, and we discuss the aspects of antibiotic use that most needs improvement. So, say that they're prescribing a certain antibiotic no matter what, like vancomycin. It's a broad spectrum, so that is usually one of the first antibiotics patients get started on. So they first find out what area needs the most improvement, and then our role is ensuring all medication orders have the dose, duration, and indications written clearly on the order. We don't want to jump to any conclusions and assume that they meant such and such just because the last patient had that specific dose. We also want to make sure that we are getting cultures before we prescribe the antibiotics, because a lot of doctors, like I said, will just prescribe a broad spectrum antibiotic and then get the cultures. So it will help if we get the cultures beforehand, so that way we can avoid giving that broad spectrum antibiotic and just give them the antibiotic that they need. And we also want to take antibiotic timeout to assess and reassess the effectiveness of the antibiotics about 48 to 72 hours. We want to sit down and talk with the doctors as we're monitoring the patient to make sure that the patient's not having any adverse reactions or allergic reactions or signs and symptoms that we just aren't, that we just don't like, that it's not looking good. And we want to make sure it's actually working. We want to make sure their fever has decreased, or their white blood cell count has been trending down, etc. We want to work with the other interdisciplinary team members to get protocols put in place to ensure that the cultures are being done beforehand. We want to make sure the timeout is the antibiotic timeout is being done, and we want to make sure that the medication orders are being double checked. So we want to put protocols in place and work with everyone and make sure everyone is on the same page. And we want to inform the doctor if we notice what they call a double coverage. So if the patient's getting 2 antibiotics, or if they're getting unnecessary combinations of antibiotics, like 2 antibiotics in the same class, or if antibiotic was started and their white blood cell is trending down and everything is looking like it's in the right direction, and then they add another antibiotic. And some examples, a patient came in and they had a fever and elevated white blood cell count, so they automatically started them on vancomycin. The patient had a chest x-ray and other imaging studies done. It didn't show any pneumonia. The patient didn't have any signs of a infection except the fever and the white blood cell count. So, and they automatically started them on vancomycin and Zosyn, and before cultures were even done. So I would want, that's an example that culture should have been done. Maybe start them on one, not start them on both. There's a number of things that could have been done differently. I also want to talk about a patient that had pneumonia and MRSA. So they started them on vancomycin, Zosyn, and Levaquin all at the same time. And that, to me, the patient had, 2 serious diseases, but, we could have started them on one and then reassessed and assessed and seen how effective one antibiotic would have been, as opposed to starting on 3 and going from there. So that's some examples that I wanted to bring up. And the importance of antibiotic stewardship and management of the Ebola virus and the development of new drugs to treat Ebola. Well, typically, since Ebola is a virus, we do not prescribe antibiotics for the virus. The bad thing about Ebola, it is mutating, and it is very serious virus. So I think that the importance of the stewardship would be that they are not jumping to conclusions whenever a patient does come in with a fever, they're not jumping to conclusions and just automatically prescribing them an antibiotic to treat the fever. They are actually running the proper test and assessing, making sure that they know exactly what they're treating before. Because there's so many different medications out there that they are trialing for the Ebola virus that if we just start prescribing all these patients with Ebola symptoms, this antibiotic and that antibiotic to try to treat their fever and everything, it's going to decrease, their immune response, and then they're going to be less susceptible to the actual treatment for the Ebola virus. So mainly just not jumping to conclusions, I think, is the main point that I got from the information we read. And that's it. Thank you.